Hello, my name's Karen Stevens. I'm a physiotherapist that works at the Hallamshire Physiotherapy Clinic in Sheffield. And I'm today going to talk a little bit about rehabilitation for people who have got balance issues, dizziness and vertigo. This is commonly called vestibular rehabilitation. Vestibular refers to the inner ear balance system that works in conjunction with our visual and touch systems to provide the brain with a variety of information to ensure that we maintain upright posture. Dizziness is one of the most common reasons that people visit their GP, and approximately 45% of people suffering from dizziness have a vestibular disorder. That is a disorder that affects either the inner ear directly or the pathway between the inner ear and the brain. So many of these conditions are amenable to rehabilitation, whether it's exercise, education, or the use of a variety of techniques to manage their symptoms. One of the most common disorders that may lead to a sudden feeling of vertigo related to head movements, vertigo being an illusion of movement, typically a spinning sensation, is a condition called benign positional paroxysmal vertigo. This is easily treated with a hands-on technique after an in-depth assessment that will confirm that indeed the person is suffering from benign positional paroxysmal vertigo. It's easily treated with one treatment session, and between 85 and 90% of people experience a complete reduction in their symptoms after this treatment. A further set of conditions that benefit from vestibular rehabilitation include labyrinthitis and vestibular neuritis. These are conditions of the inner ear, usually seen after a viral infection, that result in a person experiencing ongoing dizziness, vertigo, sense of being off balance and possibly nausea. Usually movement related, and can lead to a person becoming quite debilitated in the sense of no longer wanting to move the movements that cause the symptoms they are experiencing. Although these conditions do tend to improve spontaneously, vestibular rehabilitation can be really helpful in speeding up this process and helping those people where the natural compensation techniques that occur in the brain and in the vestibular system are not occurring. This type of vestibular rehabilitation includes a wide range of exercises. These include head-eye coordination exercises, as well as your more traditional balance exercises, where in a safe and controlled way someone challenges their balance to help it improve. There are also conditions with a neurological origin, such as multiple sclerosis, certain types of stroke, whereby dizziness is present, and again this may be to do with changes in the vestibular system, either directly in the inner ear or in the communication between the inner ear and the brain, where the person starts experiencing dizziness or vertigo. Again, a tailor-made customised vestibular exercise program may help this person either reduce the sense of dizziness or improve their balance, both leading to an improvement in function. It's very common in older people for them to experience dizziness and again vertigo that can precipitate falls. Falls is a problem for many people in their later life and leads to a reduction in function, and it again is very amenable to vestibular rehabilitation. Our vestibular systems degenerate a little with age, and sometimes it's helpful to challenge the system with again a range of exercises and an understanding of where your limits actually are opposed to where you perceive your limits to be. When someone is referred to the clinic for vestibular rehabilitation, the first thing that will happen is they undergo an assessment. This will include a an interview where we talk about what symptoms you're experiencing, when they happen, how long they last for, and how they feel to you, what kind of sensations you're experiencing. Also finding out what your medical history is, what other treatment you may have had, or what medications you're taking to help with the dizziness. Following the talking part of the assessment, I then carry out a range of tests and tasks to see if we can differentiate why you may be experiencing dizziness. This is a really important part of the process, as some types of dizziness are better treated medically, whereas others are better treated with rehabilitation. If I'm unable to help you in a rehabilitation capacity, I would make suggestions as to where you would be best placed to seek help next. Some people find that it may be helpful to visit their GP prior to a referral for vestibular rehabilitation to rule out any other potential medical causes for their dizziness. Once a cause has been established to the dizziness, if this is indeed possible with the assessment techniques available to me, then we would work together to establish a rehabilitation program that works for you. Depending on the diagnosis will depend on how much how long the program may last, and how much you may need to do at home by yourself. For conditions such as benign positional paroxysmal vertigo, it may be that a one-off treatment is all you require, whereas people suffering from dizziness due to vestibular hyperfunction, that is where one side of your vestibular system is not working as well as the other due to conditions such as labyrinthitis or vestibular neuritis, then the intervention may need to last a little bit longer, and there would be some work for you to do at home independently. For other conditions such as those with a neurological diagnosis, or for older people with balance and falls issues related to dizziness, again it would be very individual as to what program may work best for you and how long that may take to work. The evidence shows that older people and those people with vestibular hyperfunction or loss do very well with vestibular programs, and the sooner these programs start the better, and that age is no barrier to improvement seen. If you're interested in having an assessment to see whether vestibular rehabilitation may be useful for you, please contact us at the Hallamshire Physiotherapy Clinic. Thank you.